Psychiatrist Dr. Kusia said, despite the rather high predisposition to mental ailments, mental health care has been largely limited to urban areas and even more specifically to the middle and northern belts of the country, with only 3 psychiatric hospitals and 12 practicing psychiatrists for the 25 million people.
In West Africa, probably we are among the best or best 2 in West Africa. The whole of Africa probably among the best 4, but that is still not good enough at all. All it means is that not that we are doing well, but other countries are not doing well at all. So we may be ahead, but that is not good at all. Indeed, I would say our mental health care is just about 2/10. No good at all. But with the Mental Health Act that we have now, if we implement it, and I have every reason to believe that to be fully implemented, it will raise us very far to about 8 or 9/10, and then we'll be very far ahead of many other countries. I'm sure that in that case, we will become a maker, and other countries will want to come and learn from our experience. What we are not doing right is the fact that, one, our mental health care is all skewed to only a small corner of the country, so it's highly centralized, the southern part of the country. 2, it is institution-based instead of community-based, so that makes it not good enough. The fact that it's highly centralized and institution-based means that not many people have access to mental health care. And indeed, we estimate that about 98% of people who require mental health care in Ghana are not getting. So only 2% of people are getting. And even the 2%, what they are getting is not exactly quality. Every now and then, you don't have the medications that you need.
He cautioned Ghanaians to be more conscious about their mental health as the country becomes more predisposed to mental disorders as their standards of living improve.
And the situation will even worsen as we move from low middle-income country to a full-fledged middle-income country and even to first world. Tension, stresses are conditions or side effects of a developed nation. And so we should get ready for them. They'll come. We need to relax enough. We need to rest enough. We don't have the culture of routinely going on leave. And if you go on leave, just go and rest, go and have time and rest. We don't have that culture, but we need to begin to build that culture into our system.
Research shows that people with mental illness or disorders may experience a wide range of symptoms which can vary in severity. For example, anxiety may be mild or so severe that the person affected finds it impossible to concentrate on their work. But like in most illnesses, delays in early detection, treatment and support for the patient can cause distress, increase the risk of relapse, and can be harmful for the individual and their friends, family and careers. Justice Kwesi Forson's report for Joy News.